What happens if you delay Medicare Part B enrollment? Imagine missing out on important health coverage because you thought you could wait. If you are turning 65 or are already 65 and still working, understanding what happens if you delay enrolling in Medicare Part B is key. When you first become eligible at age 65, you have a 7-month window to sign up for Medicare Part B, which covers outpatient services like doctor visits and outpatient hospital care. If you do not enroll during this time and do not have other qualifying coverage, you could face a late enrollment penalty. This penalty adds 10% to your monthly Part B premium for each full 12-month period you delay signing up. So, if you wait 2 years without coverage, your premium could increase by 20%. This higher premium could last for as long as you have Part B, which can be for life. However, if you or your spouse are still working and covered by a group health plan through that employment, you might qualify for a special enrollment period. This period lasts for 8 months after your employment ends or your employer coverage stops. During this time, you can sign up for Part B without paying the late penalty. It's a good idea to enroll during this window to avoid extra costs later. If you miss your initial enrollment and the special enrollment period, you will have to wait for the General Enrollment Period, which runs from January 1st to March 31st each year. Your coverage will then start on July 1st, but you will likely owe the late enrollment penalty. For those working past 65 with employer coverage, the size of the company matters. If your employer has 20 or more employees, you can delay Part B without penalty because your employer's insurance is primary. Medicare will be secondary, so you don't need to enroll right away. But if your employer has fewer than 20 employees, Medicare becomes the main coverage, and you should enroll in Part B to avoid gaps and unexpected costs. Not enrolling in Part B when you should can also cause issues with your employer's plan. They might pay less or stop paying altogether if they find out you are Medicare eligible but not enrolled. They could also seek reimbursement for any payments made on your behalf. In summary, delaying Medicare Part B enrollment without qualifying coverage or a special enrollment period can lead to higher costs and coverage gaps. If you are working past 65 with employer insurance, check the size of your employer to know whether you can delay or need to enroll immediately. Staying informed helps you avoid surprises and keeps your health coverage smooth.